Okay, well, welcome, Dr. Zahra, again to our podcast. I'm, look, I'm looking forward to actually learning something new today with you. Um, I know that today we're going to talk about another sports injury that is very popular with people, especially the elderly that like to play tennis. So I would like you to give you the time to introduce the topic as well.
Okay, thank you so much, Francis. Thank you for having me again. It's always a pleasure. And talking about physical musculoskeletal injuries and sports injuries are it's a fun topic because first of all, it's so rampant. These types of pains and strains are so common. I see a new case at least twice a week in my clinic, 2 or 3 times a week in my clinic, and so tennis elbow, which is also a type of tendonitis, is again so common, and it's not something that always happens with the tennis player. It happens with normal wear and tear and daily use of a repetitive motion with your arm, or different types of activities, but normally over like a wear and tear over time, or an acute injury from an accident or something. And so I love to address these types of injuries because they respond so well to stem cells and platelet lysate therapy. Um, I think we mentioned, Francis, with you, platelet lysate in the past also. And the difference between stem cell therapy and platelet lysate therapy, and with our stem cells we use both. With our stem cell therapy, we combine it with the platelet lysate. And in all cases, not in all cases are stem cells required, which is sort of gold standard. Okay. um, the stem cells are very, very potent. What the platelet lysate does, though, is that platelet lysate consists of growth factors from your blood, from the platelets in your blood. And it's a concentrated growth factor that's taken from your blood, processed, and reintroduced back into the body, into injured areas or the skin, or whatever it might be. In this case, the tendons, and it can be the tendon of the elbow in the case of tendonitis, or it can be the tendons of the shoulder or the knees, or the foot or the hands, whatever it might be, or the wrist. We see a lot of wrist injuries also. So it's basically the growth factors. What they do are, they signal to the surrounding stem cells that are already in the area to come and reconstruct and regenerate the damaged tissue. And it's a very, very effective treatment, much more so than platelet-rich plasma, which is very common out there. So we only do platelet lysate with very, very, very successful results when we don't find the need to do stem cells, which is the case in many patients where they come for stem cell treatment, but we don't necessarily need to do stem cell treatment depending on the extent of the injury.
Okay, yeah, I'm very interested in this because I used to play a lot of sports, and even got myself into a professional level. And I also have a few friends that actually play tennis. And I know that tennis has a very particular thing where you only use one part of your body more than the other part, especially with the elbow. And I know that after a long session of tennis, the one of the things that they try to do is actually cool down the elbow or keep it well maintained and things like that. So with platelets and stem cells, like as you were mentioning, what will be the benefit of having this type of treatment?
Okay, good question. And actually, you touched on a really important point also, Francis, that with any sport or with any activity, the warm up and cool down is so important because it literally brings circulation to the area. It literally warms up the tissue in order to be more flexible, more pliable, that type of thing. So it keeps you less prone to injury. So I'm glad you mentioned that because I think that's a really important point. Now, the benefits of platelet lysate or stem cells are that when the injury isn't so severe, so if it's a strain or a minor with a strain or a minor a few fibers that are torn and causing injury, which can become scar tissue. When it's a condition like that, the platelet lysate works really well because it goes in and literally builds the tissue back up. In this case, the tendon or the ligament. And so, and as I mentioned earlier, the growth factors that are degranulated from the platelets, those are they literally go in there and call out to the stem cells in the area or the surrounding stem cells, because we're not injecting stem cells per se. We're injecting the concentrated growth factors that stimulate the stem cells in the area to do the work. And so the stem cells come in and they regenerate and basically reconstruct the damage. Okay, and so that's what the platelet lysate does. Now with the stem cells, we're actually injecting the stem cells directly to do their work. So we're not relying on any surrounding stem cells. And with joint injuries where we're injecting right into the joint, the blood supply is so limited inside a joint that stem cells do better. Stem cells do really well there. And so that's something to sort of differentiate. And when we do our stem cell therapy, we always do it with platelet lysate, so that we get more bang for our buck. With a booster shot, to boot 6 months down the line or a few weeks down the road also, which is included in the treatment.
So let's say for an athlete or something that is really interested about all this, and it's hurting, and they want to basically be back on the peak of their abilities and all those things. How long would a process like this will take, and what will be the results after the treatment?
Good question. So if we did say platelet lysate on an injury, depending on the extent of injury, so if it's a partial tear of a tendon or a ligament, the recovery will take longer, and in that case, I would recommend more of a stem cell therapy to repair the damage. If it's just a strained or a sprained tissue, ligament or tendon, with minor tear of the fibers, which are still intact for the most part, that could take from start to finish about 3 months for regeneration, and we should back to as good as new.
Okay, well, very, very interesting. Now, for, let's say, especially since we're talking about tennis and the tennis elbow injury or pain, the effects like you were talking about, especially if it goes from platelets to stem cells, the whole cartilage will be recovered or fully readjusted in the body if they do the stem cells?
Yes, yes. Okay. So what happens is, in both cases, there's regeneration and a rebuilding going on. Okay. tendon or a ligament, even if it's a skin tissue or an organ, it literally repairs the damage. So it's just the degree of damage that already previously existed. How much requires repair is what the only difference is. So let's say it's a bone on bone situation for a joint where there's no cartilage whatsoever. In that case, the patient may need, well, I've seen a lot of patients with bone on bone be okay with just one treatment with a good number of stem cells. In some cases, we may require 2 treatments in order to get the amount of regeneration that we want, that we're looking for. And so it depends on the degree of damage and also patient's metabolism. Okay, that plays a huge role. And then also lifestyle and you know, normal wear and tear again, and diet and things like that.
Okay. Well, I think that there's a lot of topic that we need to cover on this topic, and I know that there are many people that are very interested in this, especially, you know, not the professional, but maybe the casual person that likes to go out and all the weekends and do the casual tennis with a friend, and you know, they don't see the urgency, but the pain of not being able to actually do a sport that I like or something, because just to think about how much of a pain afterwards is going to be. And it will be interesting to, you know, for those people to you know, reach out to you, start giving you a consultation, and just say, well, what can I do? Because we know that for a professional, that's their way of living, but for someone that is not that, I mean, it's down the road, but it's something that to think about and not leave it on the to-do list.
Right, right. And Francis, the thing is that I can't give you a number, but I will say most patients that come into the clinic, it's because of one type of a pain, pain management, and so, you know, if the condition isn't so severe, the platelet lysate is something that we can do very simply and very cost effective. It depends on the degree of damage, with very, very, very good results. So that patients don't have to continue taking pain pills, and so in some cases narcotics or corticosteroid shots, which is very, very detrimental, because it's basically numbing agent, a prolonged numbing agent, where we continue to use the injured part of our body, and we continue to do more damage because we just don't feel it anymore. So this is a great way of regenerating the damage that's been done, in order to literally heal the tissues instead of covering up the symptoms with pain meds and steroid shots. So yeah.
Well, Dr. Zahra, it's been a wonderful and very interesting topic again, and I know, like you said, I mean, it doesn't just have to be on the tennis elbow. It's any joint that you use, is especially if you do any kind of sports. Of course, like we said before, I mean, for a pro athlete, that's their way of living. And this type of therapy is very accordingly to them, and it can get them back into that pro level sooner than rather later. But for the casual player, that's also another thing, and just to take off their from their mind the fact that they have to suffer just for enjoying something that they don't really like.
Right, absolutely, absolutely. Just for the common civilian that is not a professional athlete, absolutely.
Well, Dr. Zahra, I'm looking forward to actually having our next session. And for you who has actually listened, if you have any other questions, the new website, which is actually really welcoming and really nice for you to navigate and easy to do, you will have more information. We'll also be including some blogs about this thing about sports injuries, and as well, you will have the ability to actually have a chat where you can contact Dr. Zahra directly. And so again, thank you, Dr. Zahra, for your time, for all your knowledge, and I'm looking forward for the next podcast with
Yes, thank you so much, Francis. Thank you for having me, and happy Friday.
you. Same to you. Take care.
Take care.